Welcome to another edition of Health Department Roundtable. I'm your host, Chris Schultz, and with me today is our Health Director, Marty Golightly. How are you doing today, Marty?
I am very well, thank you, sir. I hope everybody's well out there. Sorry we took a little hiatus on the show, and things were going good, so we didn't really have much to report, and boy, that took a turn.
Yes, it did. So speaking of, that's a good segue. Where are we now with our numbers? I know it's not a good trend.
It is not a good trend. As of today, as of a few moments ago, we are at 41 cases in the town. We expect some of those to be cleared by Monday. They will end their isolation periods by Monday, but as of right now, 41. That brings our total case count. Sorry, I'm looking at my notes here. That brings our total case count for the pandemic over 2,200. I also wanted to talk about our weekly test positivity rate, if that's all right.
Please do.
Right now, I was pleasantly surprised when we got our data on Thursday night around 11 o'clock at night that it was only at 2.93, which is odd because that is not reflective of our current case now or the rise of cases that we've had. So there is a 2-week lag in that number. So my intuition tells me that will be significantly higher next Thursday or Wednesday when it comes out, which is kind of a bummer. I was happy to see that. And then, our cases rose about 10 after we got our first under 3 for a while. That's our first under 3 since the beginning of August, since the 8-4 numbers. I want to talk about our weekly vaccination data real quick. We are at 67.75% eligible who are fully vaccinated. So we're closing in on 70%. And we can't start talking about things like herd immunity until we're in the 75-ish range, even 80. So I'm still encouraging everybody to get vaccinated as much as possible. But that is a little bit of a rise from where we were. But our percent of every Abington resident is a little over 58.5. So, of course, that is more a function of a significant portion of the population not being eligible, right? The 11 and unders. So hopefully that'll come up when that population is able to be eligible.
Are we still confident that like late October is a?
I've been in middle of October for a while now, and I'm going to kind of stand around that area still. I anticipate that Pfizer and Moderna will be turning in their 5 to 11 data to the FDA by the end of this month. And the preprint means in scientific circles, preprint study is it has not been peer reviewed yet. So like some of the early indications that indicate that we should be able to start giving shots as soon as they're very promising results. And that's kind of where our numbers stand right now. Not very good, if I'm being 100% honest.
Yeah, I was looking at our daily numbers since we've been keeping track this morning, and it looks like since mid-August, we've been 30 or above pretty consistently.
I can tell you exactly. And I know that we don't really share our Google Doc and our trending data, but if somebody really wants to see it, we happily will share it with you. I know it's been out there for a while. But our week test, let me just pull it up real quick. Sorry. So we have been in the neighborhood of 30. We were 27, 24 since the beginning of September. We dipped down in the first week of September to a low of 19, but the week before that we were at 32. So we have been 30 in the neighborhood since the first week of August, and it's steadily climbing. It's never a straight line.
Yeah.
It's always jagged. So we just look at the trend, and it's an upward facing trend right now. I hope that answers your question.
That does.
I also want to mention while we're not doing any particular COVID shot clinics right now, our friends over at Massasoit Community College they're accepting walk-ins. The next one is Wednesday, the 22nd, from 12 to 6 p.m. and they have Pfizer and Johnson & Johnson. So you can just show up and go get your vaccine. And then if you get Johnson & Johnson, you're done. You get the Pfizer, they will tell you how to schedule your second appointment for that. We are not done giving clinics, but we're kind of in a pause until we figure out what's going on with boosters and or our 5 to 11 population. It was mentioned today on the FDA CDC call that they voted yes for third shots for 65 plus and the at-risk population, high-risk serious illness populations, 6 months after the first series ends. We are still dependent upon Massachusetts DPH to give us the okay green light, as it were, before we can start doing that. But I do anticipate us doing that as soon as we can. It might be in a bit small numbers. We might have to chunk it out more than we did with the initial rollout, but we will be offering it as soon as we can. And of course, everyone should talk to their primary care provider if they have any questions. Or if you have any questions specific to the vaccine, please give us a call. All right. I do want to talk about the Buy Next Now Stay, the home test that a lot of people are using, and the tests that are test and safe at school. Our amazing school nurses are using. It comes with 2 tests. Please wait 36 hours from the first to the second test. If it's a false positive or false negative, it takes a little time for that to kind of work itself out. So please wait that 36 hours. Also, as I understand it, there was some confusion about ethylene oxide's role in the swab sterilization. So I'm just going to briefly touch on that, and I will ask our AbCam friends to put some links in the video description. From Abbott and from the FDA specifically about that. It's really important to understand that ethylene oxide sterilization has been around for, I'd say, it's about a half a century, 40 to 50 years. And we use that on non-durable medical equipment. So like anything that goes in your body that cannot stand up to normal sterilization processes like autoclaving, which is steam under pressure, or radiation, which is obvious. It just can't hold up to that. So anybody who's been to a catheter lab and had their heart, any work on their heart, we use the thing that the thing that goes in your femoral artery and all the way up through your heart. We have to sterilize that, and we use ethylene oxide. Dental procedures, a lot of other things. So there's no residual of that chemical left. It's part of the process is to aerate it so it all goes away. And again, we'll have some links in that. Don't take my word for it. Have some links for that. And so if you have any questions, we can point you in the right direction and get those answered. You got anything else for me, Chris? What else we got?
We should probably mention our flu clinics.
We should definitely mention our flu clinic. Unlike last year, this year the flu clinic for the pediatric flu is not mandated. But we're still going to offer it as vigorously as we did last year. So I have our cool little flyer here. And if you're at Abington Celebrates this weekend, or if this comes out after this weekend, please email me and we'll let you know how to get the QR code to register, because we do ask you that you register first before you come. Our first available clinic for the pediatric flu shots will be September 22nd, which is Wednesday, right? Yeah, Wednesday from 3 to 4. And we will hold that same clinic Wednesday, 3 to 4 through October 13th. So every day, 3 to 4, and that's going to be in the Meyer Room in Town Hall. But you do have to pre-register because we have to have appointments. They're required. That's not our rule. That is the state's rule. If you need to make an appointment and you can't, or you have some type of technological deficit, don't worry about it. Give us a call and we'll make an appointment for you. We're also doing adult flu shots, and we have the higher dose flu for our seniors available. So if that's what you want, and just regular adult doses, we have those too. And we are doing those at Town Hall. And this is in addition to the ones we were offering at the Council on Aging at the Senior Center. We're doing those at Town Hall Mondays and Wednesdays, starting September 22nd, 9:30 to 11 and 2 to 3:30. Again, appointments are required. So we're going to be offering a lot of different options for a lot of different times for somebody to come in there and get their flu shot.
Awesome. And that we'll share all that information on our various social media. And always, if you have any questions, you can call the Health Department at 781-982-2119, and we'll be happy to help you.
And make sure that you follow our Facebook page and Twitter page and Instagram page and all of the other things that are there. I know we're putting a lot more stuff up there, and we're trying to actively trying to update our website to make sure that it is reflective of 2021.
Yes. Catching up with the times.
Yeah. Also, quickly, if you have any vaccine questions, give us a call. I won't just tell you what you think, what I think is right. I will also point you to the right resources. I don't say anything that I haven't thoroughly researched or I can't show you immediately after. So if you have questions about the vaccine, I know there's a lot of misinformation about how the VAERS and the vaccine reporting system. If you have a question about that, please give me a call. And we can kind of guide you to learning resources or just tell you what we know about it from our educational procedures. It's okay. I always choose education first. And I know there's a lot of talk about these mandates, and I still think education is our best weapon in this. So the more you know about the vaccine and the more you know how safe it is, I think the more likely we're going to get more people to take it. Further, this has been one of the most highly scrutinized vaccines since the development of vaccines. It also has the most funding and the most smart people in the world working on it because it shut down the entire economy. So just keep that in mind when you're reading these, whatever it is on various social media, that take it with a grain of salt. Outstanding claims in science, outstanding claims require outstanding evidence. So broad-based claims require a huge amount of evidence to prove. So just keep that in mind, and please reach out. We won't just tell you what we know. We'll tell you how we know it, and we'll tell you where to find it.
Absolutely. Abington Public Health is about your health. So
yeah, good public health is indistinguishable from a normal day. We should be invisible.
One would hope. Okay, well, I think that's all we have for our update this week. Marty, thank you.
My pleasure.
The information, and Abington Cam, thank you once again for hosting us. We'll catch you on the episode, and I will say again, in the meantime, if you have any questions or any topics you would like us to address on our roundtables, please feel free to reach out. Thank you, and stay safe.